Everyone knows that every company in the market now has a lateral retractor. They have implants that you can put in from the lateral approach. But no other company still, to date, after 20 years, has been able to replicate what NuVasive has done in terms of building not just a cage, not just screws, not just a retractor, but an entire procedure based around this philosophy of lateral access.
I think all of us as surgeons like to solve problems. The way that NuVasive approaches innovation really comes back to procedural design. It really does. I think surgeon partners are engaged from beginning to end. This is the surgery, this is the problem we're trying to solve, and then working in partnership to really develop the technologies and the tools to make that happen. I think that's where we need to focus our efforts, not only the last 20 years, but for the next 20 years. That's how we're going to get it to the next level.
Typically, surgeons understand where patients need help, where we can make a difference, and what tools we have and don't have. And it's through that relationship that we discover new ways to do more for patients that result in improved outcomes compared to what we used to do. Getting to the anterior column has proven to be really impactful for the type of patients I take care of. But the key is, how do we develop new technologies that make it safer and more reproducible? And those are two very important priorities for NuVasive, and they're also really important priorities for me as a surgeon. And when our priorities are aligned, we're able to make tremendous progress in the direction that's important to both of us.
I feel like I'm part of this history because, it changed my career, changed the success of my surgeries, and I could contribute with this philosophy and the wide indications we have nowadays with XLIF. To have the chance to work with the pioneers of the technique, to understand how they developed the technique, and to contribute further with the development over the years became turning me a better surgeon. Once I have the chance to travel everywhere in my country, teaching people how to do XLIF, I realized how reproducible the technique is. For the single cases to the more complex situations, it was always reproducible.
NuVasive's clinical validation has had a 20-year track record of standardized training, the CPD activities, so surgeons ready to perform the procedure before they go and start it on their first patients. In addition, by validating it through clinical evidence, this provides a good evidence base that what we're doing actually works, and we're critical of ourselves. All the evidence base gives me confidence when I talk to my patients about what to expect and what the outcomes are. I feel sometimes with evolving technologies, there's a trade-off. You're not necessarily sure that the patient's going to have a better result at 2 years, but with this I've got a 20-year track record that I can fall back on. So it allows me to have an honest conversation with the patients about what their experience is going to be. It's driven by a very similar experience that my colleagues are having, and that I'm comfortable and confident that they're going to get the outcome that they desire.
The best-in-class education platform that NuVasive and CPD offer surgeons and surgeon learners transforms them from relatively novice surgeons in this aspect and provides them the confidence that they can reproduce the same results that their mentors and teachers have for many years prior to them. XLIF has been transformational for me in my career, and it really represents my commitment to lifelong learning. As a surgeon, we need to be committed to be lifelong learners, otherwise we're going to be obsolete very fast. Because of XLIF, I've been willing to learn and adapt, and I've transformed my surgical skill set in a way that I would not have otherwise done. That has provided me access to a network of like-minded surgeons in the United States and frankly across the world. And it has really been the most unexpected, best part of my career that I would have never anticipated I would have experienced.
There's no doubt in my mind that NuVasive has the best surgeon education in the world. I think one of the telltale signs is every single major spine company at some point has approached me and asked, what are you guys doing differently over there? Why are surgeons so impressed when they come away from these courses? I think that speaks volumes, right? One of the most important pillars of why XLIF has been so successful is the educational component. Incorporating these adult learning principles really has changed the way surgeons approach surgery. We talk about how XLIF it's not an implant, it's not a retractor, it's not the neuromonitoring, right? It's a technique. And using these adult learning principles, they learn a superior technique.
We've been able to do a procedure, and we've been able to do it well for 20 years. We have a very good, if not excellent, sense of how this operation is done. And so from patient to patient, we are getting the same thing accomplished. Really great fusion rates, very good indirect decompression if that's what we're after, and a very, very low complication rate. And so as a patient who really has to trust me as a surgeon, that really matters. And that takes into account what the patient wants, not what I want as a surgeon. I'm here to do good for the patient. And that's what XLIF does. It allows us, it enables us to do good and to do good things for the patient.
When I did XLIF for people, and we had those tremendous outcomes where the patients are going home the next day, and then you compare that to the outcomes of the other surgeons who were doing traditional open posterior surgery, the difference is remarkable. And it wasn't just me seeing that, they were seeing it too. We have patients now who come to our clinic to come to see me for the XLIF because they have heard about their neighbors or their friends getting the procedure and doing so well. They come and ask for it by name. And if you think about it, that's pretty remarkable.